Yes. I'm sorry.
Hi, how are you doing today?
Good, thank you.
Good. My name's Amy. I'm going to be the nurse taking care of you today. I'm going to perform a head-to-toe physical exam. It should take us less than 15 minutes.
Okay.
I want you to stop me if you have any questions throughout the exam. You ready?
Yes.
All right, thank you.
Thank you.
First things first, I want to check that I have the right patient. Can you tell me your name?
Paul?
Great, and what's your date of birth?
07/15/1982.
Perfect. And can you tell me where you are today, Paul?
Chamberlain.
Great, and can you tell me who the President of the United States is?
President Barack Obama.
Great. Okay, so we're going to go ahead and go through a couple of different tests. Our bed is at the appropriate height. My patient is smiling. My patient is calm. My patient is relaxed. He is dressed appropriately for the weather. He is well nourished, answering questions appropriately, making eye contact. That sounds about right. All right, so I'm going to go ahead and take my patient's vital signs. My vital signs would consist of heart rate, respiratory rate, blood pressure, temperature, height, and weight, and all would be assessed and hopefully within normal limits. Are you in any pain today?
Negative.
Okay, great. If my patient was in pain, then I would go ahead and do an old carts assessment. So the first thing I want you to do is just put your hands on mine, and I'm going to go ahead and look at my patient's skin. So my patient's skin is pink, appropriate for ethnicity. There are multiple tattoos on the forearm. On both sides, his skin temperature is warm to the touch. It is smooth and it is well hydrated. His nails are smooth. They are chipped. Do you bite your nails?
Mm-hmm.
Yeah. And his capillary refill is less than 2 seconds. Great, I think that's about everything for the skin assessment. So the next thing that I'm going to go ahead and do is listen to his lungs. So I'm going to put my stethoscope on the front of your chest, on the back of your chest. I want you to just breathe normally for me. I'm going to put my stethoscope under your shirt.
Great.
Good. Now down the back of your shirt. Good. And I'm going to put my stethoscope right here on the right side. If you just lift your arm up for me. Great. Perfect. So my patient is breathing room air. Clear vesicular lung sounds heard bilaterally. He's not coughing. I don't need for him to deep breathe or check any mucus. There's nothing present. So I'm going to go ahead and I'm going to listen to his heart sounds. So I'm going to reach under your shirt. I'm going to listen at the aortic, pulmonic, Erb's point, tricuspid, mitral. At this location, I could then auscultate his apical pulse for regular rate and rhythm. And then I'm going to go ahead and flip my stethoscope and listen with the bell in the same locations at the aortic, pulmonic, Erb's point, tricuspid, mitral. Perfect. So looking at his neck, I see that there is no jugular vein distension. I'm going to go ahead and palpate his carotid pulse on one side. Beautiful. Carotid pulse on the other side. Good. 2+. I'm going to go ahead and check his peripheral pulses. So I want to go ahead and check the post. 2+ bilateral. Go ahead and give me your feet. I like to do it this way. It's just easier for me. I know, right? Good. So popliteal, posterior tibialis, dorsal pedis are all 2+ bilateral. I already checked his capillary refill in his fingers. I could check his capillary refill in his toes. I'm going to just do a quick peripheral vascular assessment, noticing my patient has any hair growth on his extremities. Oh, beautiful. Look at that. So bilateral. I know you're really got socks on today. Good. So what I want you to do is go ahead and just lay down for me. Just lay down. Great. So I'm going to lift your shirt up just to look at your stomach. So inspecting his stomach, he has a flat contour to his abdomen. I don't notice any pulsations. His symmetry is even. Looking at the skin of his stomach, there aren't any scars, any pulsations, any abnormalities. So I'm going to go ahead and auscultate in all 4 quadrants, starting in the right lower quadrant. Good, he's got some vowel sounds present. Normal active. I'm going to flip my stethoscope over just to listen quickly to see if there's a presence of an aortic bruit. No bruit auscultated. All right, so the next thing I'm going to have you do is go ahead and just stand up for me. And what I want you to do is just follow my motion with my arms first. So I want you to go ahead and salute a soldier. Go ahead and stick your arms out straight, zombie, good. Up overhead, Superman, out to the side, airplane. I want you to go ahead and comb your hair. One hand, other hand. Pat your lower back, one hand, other hand. Beautiful. And then go ahead and throw a softball with your right arm, throw a softball with your left arm. Beautiful. So go ahead and stick your arms out straight for me. I want you to push up, good, and then push down, good. And then I'm going to go ahead and bend your elbow. I want you to move your hand towards your head, good, and then towards me, perfect. Other arm, we're going to do the same thing. Hand towards you, hand towards me, beautiful. I want you to go ahead and put your hands, your palm to palm, push on my hand like this, perfect. Go ahead and pull back, good. So full range of motion, strength against resistance of the shoulder, elbow, and wrist. So the next thing I want you to do is kick a soccer ball. Good, kick a soccer ball with the other foot. Kick a big rubber ball. Get some hyperextension and some flexion. Good, and then go ahead and hacky sack. Get some internal, external rotation. Great, so what I want you to do is go ahead and open your legs up against, perfect. Go ahead and squeeze your thighs together, beautiful. Go ahead and have a seat up here. Great, so what I want you to do now is just raise your feet up towards the sky. Good, and go ahead and pull them back against there. Now I want you to push against me, good, and pull against me, perfect. Now what I want you to do is push your feet down, good, pull your feet back, good. Can you go ahead and point your toes towards the sky, point your toes towards the ground, lift up the inside of your feet, I lift up the outside of your feet, good. So full range of motion, strength against resistance of the hip, knee, and ankle. All right, so cranial nerves. Do you have any change in your sense of smell recently? Great, so what I want you to do is just look straight ahead. I'm gonna just look at your eyes. Perfect. Go ahead and follow my pen light. Good. So Perla, go ahead and follow, is intact. Extraocular motions are intact. Cranial nerves 2, 3, 4, and 6 are all intact. I want you to go ahead and close your eyes and just tell me when you feel this touch.
Meow. 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 Meow.
Oh, this is the video.
Meow.
Good. I want you to go ahead. I'm going to place my fingers in front of your ears. Open your jaw. Close your jaw. Open your jaw. Move side to side. Perfect. You go ahead and smile. Frown. Grimace. Puff out your cheeks. Close your eyes really, really tight. Perfect. Go ahead. So cranial nerves 5 and 7 are intact. The patient is able to hear me and answer questions. Cranial nerve number 8 is intact. I want you to go ahead and stick out your tongue and say ah. Beautiful. Cranial nerves 9 and 10 are intact. Uvula rises with phonation. Can you say light, tight, dynamite?
Light, tight, dynamite.
Beautiful. Cranial nerve number 12 is intact. Okay, so we're going to go through a series of tests in order to test your sensation. So I want you to stick your forearms out for me. And you're going to close your eyes, and I'm going to tell you kind of what you need to tell me. So first of all, I want you to tell me just when you feel me touch, say now. Good. So you can open your eyes for a brief second. This is sharp.
Okay.
This is dull. When I touch your forearm, I want you to tell me if you feel sharp or if you feel dull.
Dull. Sharp. Dull. Sharp. Dull.
Perfect. The next thing I want you to do is just tell me if you feel me touch you on the right side or on the left side. Close your eyes for this.
Right. Left. Right.
Perfect. All right, so the next thing I'm going to go ahead and do is I'm going to hit this tuning fork, and I want you to tell me if you can feel this vibration. Can you feel this vibration in your right foot? Great. Can you feel it in your left foot?
Yes.
Great. So the next thing I'm going to do is I'm going to have you close your eyes, and I'm going to hand you a couple of objects, and I want you to tell me what those objects are. What is this?
Paperclip.
Great. Next object.
Pen.
Beautiful. Final object.
Pen light.
Good. So the next thing we're going to do is I'm going to go ahead and draw a couple of numbers, only numbers, in your palm, and I want you to identify what number I drew.
Roger. 0, 1, 7.
Great. So The next thing we're going to do is what's known as 2-point discrimination. I'm going to touch your forearm in your hand, and I want you to tell me when I touch you if you feel 2 points or 1 point.
2. 2. 1. 2.
Perfect. So, patient tested stereognosis, was able to identify 3 different objects correctly, tested graphesthesia, patient was able to identify 3 different numbers correctly, and normal result for 2-point discrimination was able to differentiate 2 points from 1 point when they needed to. Now we're going to do some deep tendon reflexes bilateral. I'm going to start with the bicep. Just go ahead and relax as best as you can. Perfect. Let's go ahead and test the other side. Cross myself over here. Perfect. Then I'm going to go ahead and test the tricep reflex. Relax. Perfect. I'm going to test brachioradialis. So what I want you to do is make a fist with that hand. Just keep making a fist. Open and close, open and close, open and close, open and close. Good, perfect. So upper deep tendon reflexes, we're a +2 bilaterally. Go ahead and scoop a little bit further back on the bed for me. Great. And what I'm going to do is I'm going to just go ahead and hit. Perfect. Good. So now if you can go ahead, I'm going to just grab onto your foot here and just relax. Perfect.
You don't want to do it?
Other one? No, I do. Maybe not on video. All right, and then go ahead. I'm going to just draw the move ball. Other one. Perfect. So lower extremity pulses, patella and Achilles were both a 2+ and a positive plantar reflex is present. Do you need any help today getting off the bed?
Negative.
Any further questions about anything?
Negative.
Okay, great. Thank you so much for your time today.
Appreciate
Enjoy your
it.
day.
Thank you.